I am Dr. Srividya Venkatraman, Senior Consultant Internal Medicine at MGM Hospital. Today we are going to quickly recap about a very important health hazard which we are facing right now because of the new onslaught of the monsoon, which is diarrheal diseases. And what we call as acute diarrheal disease is sudden onset of loose motions with or without blood, watery, colorless, can be yellow colored in large quantity, copious quantity, and associated with fever, sometimes with nausea, vomiting. It is triggered by multiple factors. Most of these are waterborne, contaminated water in the surrounding, in the house, contaminated water in the workplace or at school, bad hand hygiene, eating contaminated food at hawkers, going out in public places. Some people develop this if they consume contaminated food, contaminated by vomitus. Say somebody has vomited in the nearby area, we don't know, it spreads through droplets, aerosol, but the basic thing here is that it is a waterborne disease. Now, why is it important? Because most of these diarrheal diseases are viral, what we call as rotavirus, very common in children, and it is self-limiting. That means in 48 to 72 hours it will stop on its own. The virus gets washed out, the toxin gets detoxified in the body, and it just stops. But some bacterial or parasitic diarrheas like cholera or like typhoid bacteria or Shigella, these will continue to be present in the system, continue to cause repeated persistent acute diarrheal episode till they are treated with the right kind of antiparasitic or antibacterial agent. Most of these patients we are seeing today are ending up with acute renal injury, acute renal failure, sudden onset breathlessness, sepsis, and impending doom. So very easy to handle this. If the person is having vomiting, is not able to tolerate oral, it is better to get them admitted into the hospital and give them IV fluid and IV medication till the diarrhea stops, till the fluid loss is compensated for. If the person is able to tolerate oral, give them adequate fluid at home, ORS, tender coconut water, buttermilk, but avoid fruit juices because it's sugary, it is going to add more to the dehydration, and avoid milk and milk type of cheese and paneer and all these things because it will add to the diarrhea. Now, how do we prevent these? Very simple. All hygiene parameters, hand hygiene, very stringent hand hygiene practices, wash before and after a meal, anywhere you are touching you need to wash your hands, drink boiled and cooled water, clean all the surfaces which are being touched in our house or at workplaces multiple times,